welcome to the second video in the EPNS series. I'm Anna Jansen. I'm a professor of pediatric neurology at the Antwerp University Hospital, and I'm affiliated to the University of Antwerp and to the Vrije Universiteit Brussel in Belgium. So I reach out to you today as the chair of the EPNS Advocacy and Collaboration Committee, and I'm very keen to tell you a little more about the goals and the work being undertaken by this committee. It is a new committee formed this year to coordinate the many collaborative activities which have already been developed by the EPNS, and to also consider new areas where the EPNS could focus in the future. So the Advocacy and Collaboration Committee comprises of 15 EPNS board members from around Europe, and the main goals are to first to raise the voice of child neurology and to promote the aims of the EPNS. Second, and importantly, to advocate at the highest level for the life course approach to brain health, from antenatal influences on brain development through to childhood, adolescence, and on to later life. And third, to develop fruitful collaborations with related societies. So the first step undertaken by our new committee has been to appoint an EPNS representative to each of the key organizations at national, European, and at international level. And as a result, we have now representatives in many organizations on all these different levels. And I'll give you some examples. The first of which is the World Health Organization, or the WHO, the International League Against Epilepsy, the ILAE, the European Brain Council, and also the European Brain Foundation, One Neurology, and then we have participation in 10 key European reference networks, or ERNs, in 19 neurological scientific panels of the European Academy of Neurology. And then we're also represented in the European Academy of Childhood Disability, the EACD, and the European Academy of Pediatric Societies, the European Society for Child and Adolescent Psychiatry, ESCAP, and the Société Européenne de Neurologie Pédiatrique. We already have a close link to each European Child Neurology Association in each different country through the Committee of National Training Advisors. And very importantly, we are also developing good working relationships with the patient and the parent groups, such as the European Federation of Neurological Associations, EFNA, and EURORDIS, which is the European Umbrella Organization for Rare Diseases. Each EPNS representative in these committees will take every opportunity to raise the voice of child neurology and seek to collaborate on any projects covering subjects of interest for the EPNS. A recent example of our EPNS committee work was when we were invited to be part of the consultation for the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. So this action plan aims to improve care, recovery, well-being, and participation of people living with neurological diseases across the life course, while reducing mortality, morbidity, and disability associated with these neurological conditions around the globe. So the EPNS was able to ensure that the plan had a lifespan approach and focused on delivering better outcomes for childhood neurological disorders. And this was an important achievement which will have impact in the future, we're sure. We were delighted when the plan was adopted by the World Health Assembly in May of this year. So this was a true milestone. We are now looking forward to continuing to represent our patients and their carers, to developing bright collaborations, and to advocate for pediatric neurology to help our community provide better care for our patients. It is our privilege to speaking with one voice on behalf of the entire child neurology family, and we will be sharing more news about our activities and achievements with you and with all our EPNS members in the coming months. So thank you very much for listening. If you have any questions about the EPNS, please do not hesitate to contact our EPNS admin team, Sue Hargreaves and Mel Knowles, who will be very happy to hear from you. And remember, If you are not currently an EPNS member, you are very welcome to ask about joining us. So thank you very much and goodbye for now.